Today's slide seminar is on thesis writing, and we have Dr. Anita Borges, Lab Director and Consultant Pathologist, Center for Oncopathology, Mumbai, to chair this session. And the talk is being taken by Dr. Swapnil Rane sir, who is the Professor, Department of Pathology at TMC, Mumbai. I request the participants to introduce themselves one by one.
Hi, Bharat.
Yes.
Okay, so good evening,
Hi,
everyone. I'm Dr. Bharat. I'm a second year resident in pathology from MMU Malana.
Good evening, everyone. I'm Dr. Shalini Chaudhary from AIMS Bhubaneswar, a third year PG resident in pathology.
Good evening, everyone. I'm Dr. Shalom Divya, second year PG resident from Mallareddy Institute of Medical Sciences, Hyderabad.
I think we have three only.
Dr. Shalini. I'm Dr. Nisha Modi. I'll be moderating the session along with Dr. Divyanshu Singh. The host for this webinar is Dr. Anita Borges ma'am and Gujral sir. There are a few reminders. Please go through them. And also the disclaimers. There are a few more. These are the upcoming talks. The next slide seminar will be on 24th August. It is Skin Lesion, a Pattern-Based Approach by Dr. Rajalakshmi T. And then the next slide seminar is on 29th. It is the Autopsy Findings in Sudden Death by Dr. Uma Saikia and Dr. Ajay Bahal. Now, let us start this section. I request Swapnil sir to please share his screen.
Swapnil, we can't hear you. You there?
Sir, can you please unmute yourself? Swapnil sir.
Swapnil, you are muted.
No, his
Sharing your screen.
no, I think he's got an internet problem because the screen sharing is lagging.
Yeah.
We can see the screen.
We had a trial and trial was good 10 minutes back, but let's check with him.
Yeah, am I audible now?
Yes, sir. Yes, sir.
Your screen is not visible.
Yeah, let me just unforeseen things that keep happening. So I'll just switch off the video. Maybe that will help in the entire process.
Swapnil, we can see some rectangles coming in your screen, so you'll have to share full
Refresh.
screen and don't see the students. If you see the students, then these patches come on the screen. Can you hear me, Swapnil?
Swapnil, did you change your internet connection or something?
I must be
No,
changing.
am I audible now?
You're audible, but we're getting some patches on your video on your PowerPoint.
Let me just. Now are they there?
Yes.
Yes.
Swapnil, if you can see the students, then these patches will come. Can you see the students?
No, I can't see the students now. I have closed that window.
Maybe it will go away. Okay, carry on.
All right. So the PPT is visible
Yes, sir, it is.
and it is moving. I just moved a slide.
Yes, sir, it's moving
It's
also.
moving, yes.
Yes. All right. So switching off the video helped a bit. Um, all right. So thesis writing, we're just going to talk about a few things in the next half an hour or 40 minutes. And there are a lot of philosophy behind why a thesis is there and a lot of debate whether we should have a thesis or no. And I'm not going to go into all of that and largely focus on the act of thesis writing and what are the different tools that are available, what are the common mistakes that people make in while writing the thesis. Uh, and so there are different words used often. There is thesis, there is dissertation, there is research, and a lot of them are used interchangeably. While the original uh, uh, original top original originally the two or the three different words meant different things. Usually dissertations were meant for more original research conducted by the doctoral students, while the master's students who are kind of getting introduced to the world of research would use the word thesis. These terminologies often are used interchangeably, and they not just in terms of meaning, but even in terms of the different parts of the world use them interchange differently. For example, in the European Union, the master's project is usually known as a dissertation, while in the same thing refers to a doctoral candidate's thesis dissertation in the US. It doesn't really matter. What matters is that it is essentially a research question that is a part of the training program in most masters and doctoral processes, doctoral degrees. And people are expected to go through it with the aim that they would slowly be introduced to the world of research, not just do their own research, but also analyze other people's research and take an independent decision as to whether they should use that information that they have gained while reading a new research. You will come across a lot of papers in literature, and the thesis is a way of introducing you to what constitutes a good research. And it provides you with the tools. It is aimed at providing you with the tools of analyzing literature and taking information that means that is relevant to your own work. So thesis is a long process. Doing the thesis has a lot of steps in it. We are not really going to go into the details of selecting a topic at this point of time. What we are going to focus on more on the thesis writing and the presenting of the results itself. I'm not going to talk about which statistics to do or what statistics to do. That is a topic by itself. And I'm not going to talk about the sample size decisions or ethics approval, or how to put up the application, how to get the thesis approved, and things like that. So I'm just going to focus on writing the thesis and how you should be presenting your results during once you have done all your analysis and the thesis. So if we simply divide the thesis work into three broad areas, the pre-analytical, analytical, and post-analytical areas. The pre-analytical areas are essentially the ones where you plan out your thesis, collect your data, and do all the other approvals that are required. And the analytical area is where you analyze your work. And then post-analytical is presentations of your work, which includes the writing part as well as the any oral or presentation that you do of your work. In my opinion, this should roughly be equally spaced out, and based on that, we should have a lot of time, spend roughly 1/3 of your time in analyzing your information, and 1/3 of your time in the entire period writing the work. How much time is a different story. Some people can, it depends on the topic. If there's a lot of data that needs to be generated, it can take some more time. But you should work on areas where you spend at least a half of your time analyzing and writing your thesis rather than on the data collection itself. But practically, what I have seen is that most of the time, people and residents, especially in pathology or most of the other areas as well, spend a lot of time in collecting the data. They spend a lot of time simply getting data and they don't work on getting the data on time. And as a result, they are left with a very small amount of period. So in the 2.5 years of time that you have to do your thesis, people often spend 2 years collecting data and getting up to the analysis state. And then they are in a hurry, and often the analysis and the writing part suffers significantly. So let's come quickly to the components of a thesis that is often written. This is just an outline of the thesis sections that are usually there. It is a structured document. It is a structured document, and it should have these kind of headings. And you can use different places, different universities, different disciplines use different word for the same thing. Sometimes people use synopsis, sometimes dissertation. References can be called as bibliography. Literature review can sometimes be called backgrounds. Conclusions can be called interpretations, and things like that. But it doesn't really matter. Broadly, these are the headings, and I'm largely going to focus on the areas that are marked in yellow and green, and some of the results discussion and conclusion sections. The most of the areas that are before the review of literature and before are already in the pre-analytical stage. You often have decided a lot of these things when you have planned your thesis. One thing that matters is that this structured document allows you to present your research in a logical and clear manner, so that the person reading it can understand your document, understand your thesis much more easily. It has to be an original work. So that is something that one has to always remember. It cannot be copy paste or simply even when you quote somebody else's work or literature, then it has to be done in a specific way. It is always written in the past tense, and since you have already done the work and now you are presenting the results. Now let's quickly go into the initial pass. Sometimes this is the title page, which often there's a student, the title, and what program, etc. This is not something that I want to delve too much into. Let's go on to the abstract and the introduction part. This is usually a summary of your entire thesis, starting from the why you did this thesis, what were your results. There is no guideline as to how long this particular section is, but usually this is a very concise and a concise summary of your work. It has to be critical, clear, and it is usually the first thing that anyone will read who takes your document in hand. It highlights the various reasons why you did, how you did, what results you got. It can be a structured as well as a unstructured document. So as you see, there are two examples that I have placed over here, that many times the abstracts in a research paper are placed as in a structured way, where you have introduction, materials and methods, and results section, as well as the conclusions. But many times the abstract can be a simple descriptive paragraph in a non-structured way. So this also changes between universities and disciplines. This is something that you need to take into account. If it is a structured abstract or introduction, then usually this is the background that we do. We usually have 2 or 3 lines that describe exactly different areas, the what did you do and how you did it. But as I said, most importantly is that you have to make sure that the most important results and most important findings are placed over here. You should never copy paste things from even your own text or the results or the conclusion that you've written in the rest of the document. You should usually this will not have any tables or figures or any references, and this is just a clear, straight presentation of half a page or 1 page summary, which gives the entire idea of what this thesis is. Going on to the literature review, this is the one of the major components that people spend a lot of time on. You essentially are reviewing the entire background work that has happened in this particular area of your topic, and you're trying to delineate, know everything about it. You want to know what is already known. You want to know what can be done, what is not done, and then it also lays the background for why you are doing the thesis. A good review of literature usually demonstrates your familiarity with the topic and shows that you have spent a lot of time analyzing publicly available literature. And this usually is the area one which find most difficult because it has a lot of referencing work that one needs to do. This also allows you to position your work with respect to other theories and other work that has already happened. It allows you to define your question that you want to answer in your thesis. It also allows you to evaluate the current state of research and demonstrates your knowledge to the public in general or the other scholars who are going to evaluate your work or read your work. So how do you go about doing this? Whatever topic that you are thinking of researching, you have to start by searching for relevant literature. You do this by first creating a short list of keywords and then searching relevant sources, which is often PubMed. There are other sources that are available. Access to free text or complete text makes a difference in evaluating those sources. But however, at least the abstract you usually have complete access to. Once you do that, you have collected all the research, the available as you access all of the research that is publicly available. You should be able to evaluate which research are good quality and what information is available and what information you should neglect. This is usually a very complex task and it depends on a lot of factors, including how many patients have been included, what time period it was done. Some studies might be done many years back, many decades back. They may not be relevant. Your review of literature has to cover a more recent time period, and you should analyze which studies you should include in the review of literature or no, whether the particular study you should include or no. There are always some studies which make a big impact and they change the way people think, and those are the studies that you often would like to include in your review of literature. And many times case reports, etc., not often don't make it to the review of literature. You should analyze every study that you are going to use for their strengths and weaknesses and try to come to a conclusion as to whether they answer a particular question adequately or no. Another thing that you would like to consider is whether the study that you're evaluating is applicable in your setup. Maybe all the studies are done in the Western countries and you don't have any data or literature available from the Indian subcontinent. And therefore, that is the reason that you want to do this particular study. Or there is a difference in the general distribution of the disease in your population, and therefore you want to study what is exactly different between our population and the other population in which the studies have been done. So we generally present all of this by not as simply stating the data, but trying to summarize and interpret the public available literature. We identified trends and patterns, certain themes that are there. Are there any particular debates or conflicts and contradictions where the different sources disagree with each other? Are there any specific studies that are most influential? And is there something that is really missing from literature? Once you have all of this worked out, you try and present all of this information in a logical way. So this you may do as a chronological event, series of events where you start off with the oldest kind of work and then go on to the more recent work, or you can present it in a more question answers kind of thing where your the topic that you are trying to address makes more sense in a thematic way. The actual writing part, you should logically group your review of literature into paragraphs, use subheadings. This is an example of one of the theses where the entire review of literature was grouped into a lot of headings and subheadings to make it a logical, address the different parts of the thesis, the different areas that have been addressed as a part of thesis. Another thing that often helps that you have to remember that you have to summarize the data, not simply state every data. So this is an example that I would like to place where a lot of number of studies have been have the data from number of studies has been summarized, and exactly the each of the study has been referenced and quoted in quite detailed, and independent interpretations have been made. Figures and untables can be used to summarize the review of literature, and therefore, even when you use figures, you should never really copy paste the entire thing. You should get inspired from these images and create your own images and try and make more meaningful impact with your review of literature. You can often end this work, this review of literature, with justification why you are doing your thesis, and it lays the background for your aims and objectives. Going on to the aims and objectives, aim is different from objectives. Aim is the overall goal or the purpose of the study. It is ideally a question that is to be answered, but oftentimes this question may be an open-ended question where you are not totally sure as to what you might find in your thesis. Having said that, the objectives allow you to break down your aim into logical actions and steps that you need to do to achieve your aim. It kind of divides your clear road, it divides your work into clear set of actions that you would do, and allows you to keep a track of keep a track of your work so that it does not deviate from your overall aim that you want to achieve. Usually all of this has to be planned well in advance, and this is not something that you are going to do at the end of it. Having said that, I just thought that I should have a small section on what the aims and what the difference between aims and objectives. This is an example of aims and objectives. There are two examples that I put forth over here. Over here, for example, the left-hand side, you have a aim where you want to perform a clinico-pathologic audit of a certain entity in an institute for between a certain particular time period, and then you're dividing it into the three different tasks as to what exactly you would do during this particular work that you are trying to do. Going on to the next section, the materials and methods. Materials are essentially a description of all the things that you used, the patients, the samples, usually a description of the inclusion and exclusion criteria in detail as much as possible. All these sections have to be extremely detailed. The purpose of doing this is that anybody who's reading your work should be able to replicate your work and come to a similar conclusion. And the method section usually represents exactly what you did. It is a description of the entire procedures, the protocols that you followed, the tests that you did, the statistical methods, the analysis that you performed, any sample size calculation or anything that else that you did, and your justification for what you did. So the methods are what you did and materials are what you use. So these are the two things that one needs to be very clear what is the difference. Although we group them into materials and methods, it is useful to separate the parts into these logical groups. Often you can use flowcharts and consort diagrams to make the entire materials and methods section more comprehensible and easy to understand, especially if there is a lot of complicated subsections in your thesis. This is an example of kind of a flowchart or a consort diagram that the thesis can include. Coming to the results section, the results are always written in the past tense. It is not important how long the results are, but it essentially also depends upon how much data you collected over a period of time and what all were your objectives and how you analyzed it. Having said that, your results should be as concise as possible. You're trying to tell a story, and therefore you cannot really simply drag on the results forever. You might have a lot of results that you might have analyzed and got, but you should only present your results that are relevant to your aims and objectives. To state your results as objectively as possible and avoid speculative words in this particular area. So words like appears, implies, looks like, or other similar words should be avoided. You should simply state your results in this particular section. If there are other results which are not relevant to your aims and objectives, but they appeared later on as you were doing, and you still want to include them, you could include them as an appendix as you go along. The results should include both positive and negative results. You should include the descriptive stats. You should have the inferential statistics also, include the p-values, the other statistical values that are there. It is important. So the results are usually presented as text, tables, and figures. But you have to make sure that you do not duplicate everything that is there in the text, in the images, in the tables, and all these three things have to be complementary to each other. You should not shy away from results that did not fit your expectation and assumptions. You should be as truthful as possible in presenting those results. At this point in the results, you're not to speculate or discuss them. That is to be restricted for the discussion and conclusion part. So as I said over here, results should tell a story. You often start from the broadest results and go on to the details of each sub-areas. The right-hand side is a summary table of the different results of a particular thesis and how this particular author presents this in a very structured way. You should group those results into logical sections, and then survival analysis, if you are doing it all, should usually comes quite at the end of the particular thesis. You should start. Anybody saying anything?
No, it's okay. Swapnil, carry on.
Okay. So you should describe your study. Start by describing your study population, the numbers, the age profile, the gender distribution, the stage distribution of disease, if relevant, treatment patterns and treatment profiles. You should use tables and figures as much as possible. And you should never repeat your results in text, figures, and tables. So I often use the tables and figures to present the results and the text to describe and interpret, often the make meaningful summarizations of the results that are shown in the figures and tables. You have to refer to these figures. Every figure and table that you present has to be referenced in the results section and your discussion section. So the images and tables are useful to communicate a lot of data and at the same time give a concise overview of the various results. You should include the p-values and other statistical measures also in them. Graphs and charts are usually used to visualize the trends and results. You should always have a heading to your table, heading to your results, and have a footnote and as well as details about what exactly is being talked about in the tables. Figures, you should have a figure number, figure title, and which essentially tells what is this image. If it is and you should have a figure legend. If it is a histology image, you should have details of stain, details of magnification, and put a small note as to what this image is, what you are trying to show in this particular image. You should not put images separate. You should try and group related images that depict a particular story together form a panel. Like in this particular case, post chemotherapy changes are being shown in a single panel of images. And you have to use images and charts and figures to essentially express your entire work more effectively. This is another example of some charts. As you can see, even in the figures, we are putting in the statistical results, the p-values, etc. And there is a title, there is a small legend which tells exactly what is being shown in each of these particular images. The next section, which is one of the most important sections, is the discussion. You often, this is the place where you interpret your results. To do that, one of the first steps is to actually have a short summary of your results in this. Do not state, we do not restate the entire result, but you talk about the most key values, key results that you found in your entire thesis. We do not introduce new results over here, and we do not try and overinterpret or overstate or inflate your findings in this particular area. We discuss the correlations, patterns, relationships among the data, whether it supports the hypothesis or the question that we try to answer. We try and discuss it with any previous research and theory that we found in our review of literature. If our results are unexpected and go in a different direction as compared to the existing literature, we possibly try and explain their significance, as well as try and identify why they are different. This might simply be a difference in the population. It might be in the way the data was sampled. It might be that some of the studies were done in a tertiary care center versus a general population or a population-based study. So all of these factors make a difference, and you have to try and interpret your results in light of these findings. We also then try and provide the implications of these results. Do they contribute any new information? Do they challenge any existing theories, or are they in line with existing theories? So these are the things that we try and answer in this particular section. One of the most easy way of doing this is actually putting in a table which brings in your most the most important studies in literature and your study, and putting it together in a table with comparison of the most important parameters across the different studies. This is a very illustrative way of presenting results and discussing the implications and comparing your study with other studies with other papers that might have been presented before. You should always acknowledge the limitations of your study. The limitations are not meant for berating you or for showing you down, but it is aimed as to strengthen your credibility as a researcher, to show that you can analyze your results independently and know the strengths and limitations of your work. These limitations can be as simple as small sample size, or it might be a skewness that is there due to the sampling methods, or there were problems in the data collection that you faced some problems during. Suddenly you expected something to happen, but the data was not easy to come by. A lot of patients might have exited from the study, and how all these issues were dealt with. You should also be aware about the biases that are there in any research. Whether there are any data biases, whether your analysis bias, or there's a population bias basically a population is skewed, that maybe perhaps all your patients belong to a particular age group, and therefore it is not directly comparable to the other studies that are there. You should always also try and understand whether the results are generalizable. Doing this study by itself has no value if the results cannot be applied to the general population. And you should try and analyze if these results can be generalizable. And you do this by analyzing your population, whether it is representative of the general population that you want to base your study on. And if the methods that you used were robust enough. You should identify the confounding variables, if any, and also try, maybe there's certain questions might be out of scope of your study. So all of these findings you should put in this particular section in the discussion, and all of these are limitations or drawbacks or shortcomings of your study, which you should not hide from. You should always present them truthfully. Finally, you should, if there is something that comes, if there is a meaningful result, meaningful interpretation, then you should present your own recommendations, if at all, for practical implementation. But often you might find that you might identify a missing point in your research, and then you should suggest how you can overcome this limitation in future research. In summary, a discussion is essentially a summary of your key findings. End it with it is the present. You can use sentences like these, that these findings confirm our hypothesis, or our findings agree with the theory proposed by XYZ. The data provide new evidence of this, or it supports a particular hypothesis, and so on. So these are some practical examples of sentences that I have put over here as to what might be the way you should write a particular the discussion section of your thesis. You should never restate, once again I reiterate, that you should never restate all your results. You should never introduce any new results in this particular section. You should not speculate on anything that is not supported by your data. You should interpret only based on the results that you have presented. And you should never talk about these results that do not directly relate to your question or the hypothesis. Coming to the conclusion part of your thesis, it is again a short summary of your entire work, but the difference over here is that you essentially restate a single statement of what you set out to do. Mention the key important results that you found, and explain why your results were relevant, and have a clear takeaway message from it. It might have recommendations, but you essentially try and wrap it up in a complete way, whether the work that you did answers the question or it did not fail to answer the question. So essentially, it is a completion statement of your entire work, and usually the last part of it. Coming to the people that the part that people find most difficult, the references part. This is important because it shows a number of things. That it shows that whether you have done an adequate review of existing literature, whether and how you have referenced those particular work in those particular papers and work in your thesis. The number of references is not important. It all matters on the originality of the work. Often, if it is a topic which is already done multiple times previously, you might have a lot of references. But if it is a work, something which is very unique, then you may not have too many references. This is an example of one of the thesis which I had done, where there were just 2 or 3 references that were there in the entire work. The work was totally novel and had never been done before, and therefore these things, it all depends on what the work is. The formatting of the reference is extremely important. There is a particular style that every thesis, university, committee, or the paper or the journal follows, and it is important to stick to that particular style. Common mistake that people make while handling references is that they don't reference the publications or results that they are using from another work or referencing, mentioning it over there. So not referencing this is one of the common mistakes people do, often out of ignorance rather than deliberately. It also, if you use less references, is often taken as that you have not researched the topic adequately. Of course, access to existing literature in full text papers matters. People often make English grammar and punctuation and spelling mistakes. It essentially puts you off, puts the reader off, and it makes it unreadable for the opposite person. And people often present unclear conclusions, and you should always provide a clear set of statements of the outcome of the study, including the negative ones. So there are some, while these are often mistakes due to errors of omission, there are some mistakes which are kind of considered grave errors, which one should be very careful about, and this often is taken as a area of medical research misconduct. One of the example is to actually make up your data or to have portray false data. This is something that is not taken very lightly in any university or any paper or anywhere in the community. You should never fabricate your data or manipulate your data in any way, or the images or the figures. And there are a lot of examples in literature and the news articles as well, where very senior authors and very senior people have had to face a lot of consequences due to their research misconduct. You should never try and be as truthful as possible. You should never adequate referencing is therefore required, because sometimes people it can be interpreted as a plagiarism or stealing of ideas, or using other authors' languages, or copy pasting other people's work into your and presenting it as your own work. So, having said that, there are ways of using ideas, especially during the review of literature from other people, to present and uh, to build up your thesis. There are some ways of paraphrasing work that has already been done. You should make sure that the author is accurately represented in your work, and simply changing one word or the here over there or rearranging the words is not considered as a good way of representing other people's work. You always use correct citation information, and if you're paraphrasing a long passage, you may consider reconfiguring the order of the ideas if necessary. Now, so these are things that you need to be careful while you make sure. There are now tools available online as well as offline that help you avoid these kind of mistakes. Many of these are free, some are paid tools. Some of them might be subscribed to by your university or organization, and you should take help of those. And often libraries, institute libraries have a lot of offer these services to their students to make sure that the plagiarism does not happen in your thesis. Now, having said that, this is a big task, and there are a lot of tools that are available in current digital era to accelerate all of this work. So there's a lot of tables, and one of the component is creating an index, where you also have to provide your index of figures and index of tables and all of those things. There are a lot of ways in which all of this can be automated. So, for example, you can use some of the tools that I'm showing in the Word software, and you can the left-hand side shows an index which is written by hand and manually done, versus the right-hand side shows an example of a detailed table and an index of figure that is automatically created using these tools that are available in Word. So all of these things help you reduce your work significantly. You should always use the spelling and grammar check that is available in the softwares that you're using for writing in the text editor. You might use a third-party tool or inbuilt tools often. You often send your article, your work to your guides, and there are a lot of tools available for tracking the changes, reviewing comments from author, from your guide, from your people who are contributing to your work. And you should use these tools to make your work less. Try and reduce your work of keeping your document tidy. Referencing again is a complex task. Previously, people used to do this manually, and it was one of the biggest tasks that people used to spend a lot of time. It is a laborious and a time-consuming process, and often error-prone, and is one of the sources where people make a lot of mistakes. There are a lot of tools now available. Some of my favorites are EndNote and Mendeley, but there are other tools that are available, many of them free. Some of them are paid for, and the best part is that they often integrate with your word editing softwares, and you can actually build your referencing bibliographies very easily. In summary, your research work or your thesis has to be original. You always use your own words, do not copy paste. Report your methods in detail. Anyone else should also be able to replicate. You should be as truthful as possible about your results, present both the positive and the negative results. You should interpret and analyze your results in light of your existing and past literature and make conclusions that are supported by your results. You should report your limitations and suggest ways of improving further research in this particular area. And you should take use of all the tools that are available currently and will be available in the future to make your task as easy as possible. That's it from my side at this point. This is all I wanted to talk about as far as thesis goes. Thesis writing goes. There are many aspects of thesis writing which I have not dealt upon, and it's obviously not possible to deal with all of those in a single session.
So there's one question from the audience.
Yes.
As an assessor or reader, do we need to cancel the facts if candidate express all clinical data not involved in objectives agreed by academic board during protocol book that was approved by ethical board?
Yeah. So any research work has to be approved and limit itself to the ethical approval that has been obtained. If for some reason your work goes beyond the approval that you initially had, you should apply for reapproval and addition of those elements into your work. That is essential as a part of the ethics process. Now, at the time of assessment, whether this is important or no, that is a very difficult question, since you're not the one who has written the thesis. But this is simple. If some work has gone, includes components which have not been approved by the ethical board, we should assess how grave is the deviation, whether it does affect the patient rights in any way, or is it simply an aspect which was it is a matter of only literature review. So depending on the aspect, the severity of the deviation should be assessed, and accordingly rectification should be sought. So if you're assessing this thesis, I think if I was assessing a thesis and if I found these deviations, I would not simply reject everything, but assess the seriousness of the deviation based on whether it affects the patient rights or no.
Thank you, sir.
Thank you so much, Swapnil, for this very short but comprehensive. You've dealt with how somebody should write a thesis. There is somebody who has asked, is this format of the thesis writing applicable for all branches, or is this essentially for, I guess, for pathology?
As I said, these things will change from university to university and from branches to branches. Some things might not be relevant. I've presented the broad layout, but it is, you might use different words. But this is a very broad layout. It may not be applicable verbatim for everything.
Okay.
For every
There are three students over here, Swapnil. We have Bharat and Divya and Shalini. Let me ask them if they have any questions for you. And do you have anything that you would like to ask them about? Any of you have any questions, Divya or Bharat or Shalini, for Dr. Swapnil? No questions? Your things that might have come up during your own thesis. You don't have to tell people what your thesis are, but did you have any questions that you asked yourself, or your all of you said that you discussed your thesis with your guides, right? Bharat, you discussed, right?
Yes, ma'am, I did.
Alright,
Yes, ma'am.
good. So what did you discuss, Bharat, with your guide? You don't have to say what your thesis is, but in general.
Ma'am, like the first thing which did come up was like, yeah, I have a co-guide. She's from radiotherapy.
You have a co-guide, I see, okay.
So she's the one who's actually like sending the cases which were already diagnosed as like my case, which I've included in my. But the main problem was that that's what I wanted to ask my guide also. That
So then, why don't you put it to Dr. Swapnil? What was the problem?
There was exactly like speaking, there was no problem. I just wanted, like, this was a discussion which was happening initially, like the cases which I have taken, and according to whatever literature was there, to know, like I discussed it with my guide as well, that how will I further use strategies to further prove it, or if I need it, or maybe like if I have a comprehensive clinical history of the patient, and he did provide me with all the tools which were needed. One of them was definitely Mendeley. I also used an online platform called the Kobo Toolbox, which we use in our institution, where we have uploaded all the information regarding every case which comes, the photos of the biopsies, and the history of the patients. So that was another tool which helps me in collecting my data and subsequently entering it.
Okay.
I have a few questions. Have you I mean, I'm assuming you have done some review of literature and in your thesis, and so how are you managing the references or the data? I mean, the papers that you are reading.
Sir, what I'm currently doing is that I have Mendeley Reference Manager with me, and whatever article or anything which I read, there is a common folder which I share with my guide. So whatever I'm reading, I just drop that particular article in that particular folder, so that even he can read it. And so that's how I share my thing. And
Yeah.
vice
So this
versa.
is something that is quite a positive aspect in recent years or the past decade. A lot of online tools, collaborative platforms are now available, and they're not very expensive as well. Many of them are free, which allow people to work together, share data, manage a lot of information. And reference management is something that in my time was initially my colleagues never used referencing until I showed them how you can use reference managers to manage all the work together. Even today, although people are well versed with digital platforms, getting access to statistical softwares or referencing software is something that I find people are not able to do. Often because the most common platforms are quite are paid and quite expensive, like EndNote. But as you said, you use Mendeley, which is a free service, and knowing that such free services exist is often the limitation. People don't know that there are such softwares and services that are available which people can use. People still use SPSS, which is a paid software for statistical analysis, but there are many free softwares that are available, and even Excel allows you to do a lot of these analysis to uh, to uh, to make to manage your data and to analyze it in a meaningful way.
So, in your experience, are there any more reference managers which you think are better than Mendeley, or maybe even paid ones which are might easier user interface or like something like that, sir?
So EndNote is the classical uh, bibliographic software, but it is a paid service. It is in my experience, it is an expensive thing for any individual to buy. Often institutes can buy and then share it with their students to use them. But uh, more than which software, what is matters is you stick to a particular software and use it regularly, because it takes certain time to get used to the interface. So try and understand how the software works, what it does, how to extract exactly what you want from it. So it takes some time and effort to understand that. So that effort you'll also need in EndNote. That effort you also need in Zotero. You'll also need in Mendeley. So it doesn't really matter. Finally, what matters is how the end product.
Do you have anything to ask, Divya? What did you discuss with your guide? You said you discussed. So did you actually have a discussion? Did you feel you are muted, Divya? Divya, you're muted. Can you unmute yourself? Ruchi, can you unmute Divya, please?
Divya is unmuted.
Now I can see that she's
Divya, say hello. Can't you?
no, she's muted.
I'm unmuting her. I'm unmuting her. Divya,
Okay.
just unmute.
Yeah.
Yes. So did you have a discussion with your guide on anything?
Yes, ma'am. I did have a discussion, but it was more so like, how is this thesis going to be actually useful? Like, what is the purpose of this thesis? More than the statistical aspects, we discussed about the basic utility of the thesis, like as to why are we doing it and what is the benefit of the thesis as such.
All right. I think that's useful when you're discussing any thesis with your guide, and I think Swapnil said that very well. You know, when I used to give a thesis or I used to discuss, I never actually ever gave a thesis to a student. Right? I used to ask the student to go away and think about what they would like to do. Okay, and then they came back, and if there was something interesting that the student was thinking about, well, then that was fine. Otherwise, I always had something that I thought was interesting and then asked the student why it was interesting. But there were 5 things I normally used to tell the students, and I think Swapnil did it in his own way. And that is every thesis, every study that you want to do, or for that matter, a paper that you want to present, even if it is a case report, all right, must have 5 questions that are asked. Number one, and most important, is why do I want to do this study? Or why do I want to present this paper? Or why do I want to, present or publish this case report? Now that first why question, okay, is the kind that answers the question that Swapnil talked about. And what was that? When you ask yourself why, about that, it tells you it has to be that you are answering a question which has not, or presenting something which has not been presented before, or if it has been presented before, how will it add to the existing literature? Okay, so if you have to write your thesis or even think about whether you want to do that study, it tells you about the background. It gives you the lacunae, or you are thinking about the lacunae in that background framework. In what way will your study, or for that matter, your paper that you're going to publish, fill in some lacuna in that background? Okay, so that's a very important number one, I think, and I hope Swapnil agrees with me. Question: why do I want to do it? All right, and sometimes I think even, you know, when people present, say, a case study, all right, and you ask them, why have you presented this case study, or why do you have a poster somewhere which has got one case? And the answer often is, because I have come across one. Okay, but that's perhaps not a good enough answer. Yeah, you have to have a really good answer to this why question, which will make your data, your publication, or presentation really solid. Okay, then the next question is, what did I do? So after you've answered the background, you've given yourself a reason for wanting to do the study, and you are satisfied that that is going to interest people as well with what your study is going to do. You can always do a study for your own benefit, you know, but if it's already there in the literature, it's probably not going to enthuse a lot of other people. What did I do? And what did I do is what you put in materials and methods. Okay, what are the cases I decided to pull out? What did I include? What did I exclude? What are the, you know, the usual things are materials and methods. And I think Swapnil talked about it, so I'm not going to go, but it answers that question, what did I do? Number 3 is results. So what did I find? So you can't mix up materials and methods and results. It has materials and methods answers a very specific question, and that is, what did I do? What did I find is what you have in results. You don't have to compare in results with anybody else's results. That comes in the next thing, which is discussion. Yeah, and that discussion is, what does it mean? That's what it answers. Okay, so why did I do this study? What did I do? What did I find? 4 is, what does it mean? Now you've got some results, and what do those results mean for the rest of the world, for yourself, for your own institution? When you compare, you contrast, if there is anything to compare and contrast, something that you're doing now, maybe what was your institute, what did you find, or somebody has already published a paper 20 years ago from your institution, how is this different from what was published before, whatever. But that question is, what does it mean in the discussion, all right? And then finally you have a summary and conclusion, and that generally is, what is the message? So you have done all this thing, and the message has to be short and succinct, and that message just encompasses everything that you have done before. And nowadays, a lot of journals, when you publish something, even your abstract has to go through these 5 or answer these 5 questions. Okay, so your aims and objectives are part of your why did I do this study. Okay, it can also be a part of what it is that you're going to do, but what you do is dependent on your aims and objectives. So these 5 things, if you keep in mind, even when you're formulating your thesis, however long it is going to be, I think it will help you to be systematic about what you do. Do you agree with that, Swapnil? That's basically what you were saying. Would you like to add to that, or?
No, I think that is essentially what I said and what you are saying in a different way. That it answers those 5 questions, and each section answers a different question in a particular way. So important to keep them separate and clear so that people can understand it easily. And it is readable. So keeping them separate makes it a readable document rather than having it go to and fro between the different ideas.
Okay, surprised that nobody's asking a question, which is a question that as teachers one often gets. What is the minimum number of cases I need to collect or to study to make my thesis, sort of pass the test of being accepted by your examiners? Now, I'm sure that some of the students are going for their MDs, others are going for their DNB, okay? And I am not sure about the MD, but I do know that the DNB has got a very structured and a very, I think, strict kind of, if there are any DNB students, maybe they can refer to it as to what they can and cannot do. For instance, you cannot do a wholly retrospective study for the DNB. That's there. Yeah, so if you want to do a retrospective study, then it must have a certain amount of a prospective study. Okay, so I'm not sure that it is there with the MDs anymore, but I know since I sit on ethics committees that the DNB requires that kind of study. So the question often arises as to how little is too little. Would you like to answer that question, Swapnil?
Yeah, I mean, that is a difficult question to answer because it depends on the question being asked and exactly what we are trying to prove. So many times people, students and other researchers and in our work, when we sit together and try to answer how many cases should we take, uh, we often start with the very basic. What is it that we are trying to do? And what is the assumption? So most sample calculations are based on assumptions. So you assume that your population would have a certain distribution. So let's say that that the incidence of a particular disease is 10%. But at the end of final thesis, if your incidence turns out to be 50%, the same sample calculations are not going to work. So those things matter, and there is no minimum number that matters. That can be prescribed as such. If it is perhaps just I mean, as you said, it has to be a prospective study. Then you have to have a very specific question to come to a decision as to how many cases are to be included. But more than that, I think that number also has to be practical. So that balance has to be there. That it should be doable in those 2 years of data collection or 1.5 year of data collection that you want to do. So if the number calculations turn out based on your calculation that you need 1,000 cases, but you get only 100 cases in a year, it is going to be difficult to get, that kind of a sample. So this has to be balanced out by the sample calculation as empowering your thesis or your prospective component to answer a particular question to what is practically feasible.
Yeah, I think that Swapnil has said it right. See, it depends on what kind of, if you're doing a qualitative thesis, in which case you're describing cases and you're, doing that, obviously the answer is the more that you do, the better it is. But I think that you have to come to a reasonable If it is one particular kind of diagnostic entity, then, you know, anything less than about 25, 30, maybe 50 cases is not going to answer any question of. But say you're doing something in hematology or something in biochemistry, and you're studying a group of people to make, if you're going to draw statistical conclusions about it, and it is more than just a descriptive term, then obviously you will probably have to go to either, if you're good at it, you can do it yourself, or you can go to a biostatistician and ask a biostatistician, and the biostatistician will give you an answer based on what is the expected, what does the literature say, or your background information say is the expected answer to whatever it is that you're trying to figure out. And in which case, that has to form part of the calculation of your sample size. Okay, so if it's a qualitative descriptive study, perhaps, you can say you're studying something like, solitary lesions in the lung. And your radiologist or whatever is collaborating with you, and he's got these solitary lesions in the lung. Now, it obviously depends on how many have been seen and what is and if you find that all your solitary lesions are essentially just hematomas, then it doesn't make much sense, right? That means that either your institution does not see enough to give you a complete variety of what is. So you need to do a little bit of homework before you accept the question that is being asked for you to ask in that in a particular way. All right. Are there any? Yes, there was a question over here, and it says this is from Raja Lakshmi. She says, in this age of electronic submissions and full texts of theses being easily available on university databases, how can students safeguard their data? Any ideas, Swapnil?
It depends on what you mean by data. So if you mean raw data, then that is something else. But if you mean simply that the thesis is available publicly, then I think that is, this is one of the intentions of a thesis, right? To make it available for the general population to read and to digest. I mean, it is a fact, just because the works are available, you are able to do a review of literature. So by often raw data is not made publicly available, although now certain journals especially mandate that the raw data be made available in the public domain for the paper to be accepted. But the very reason of all of this is to make sure that the ethical and the research integrity is maintained and people are able to replicate the results. The idea is that if results are not replicable, then they are not generalizable, and therefore they have very low value. So so it depends. So just because the thesis is available on the university server doesn't make it a problem. I think it should be encouraged, because a thesis is simply an interpretation of your raw data and the work that you've done. Putting it out there gives an opportunity for people to comment on it, for you to learn from it. And now there are preprint servers from universities where people put their work before they do actual publication, just to get inputs from people as to how whether their work is of good quality or not.
Yeah, I suspect, although it hasn't been made very clear over here, that Rajalakshmi is talking about, stealing of or plagiarizing images and not actually raw data, which images are raw data, of course, that people can pick. like people often do, even when you're giving a talk or a lecture or something like that, somebody has access to the to your to whoever is showing that data. That means, you know, the guy who has downloaded your PowerPoint or whatever. So I think Rajalakshmi, if you want to ask that question a little bit more in depth, I guess that's what Rajalakshmi means, and I don't think that there is any way that you can actually do this. If you publish it, then there are you know, if somebody wants to steal your data or steal your images and other things and publish it, nowadays publishers have some very you know, major good ways of figuring out what has been plagiarized, you know. So I think that you probably are relatively assured of, unless somebody is publishing it in a very low impact journal, in which case, yes, almost anything can go. I don't know if that answers your question, Rajalakshmi, but in principle, I agree with what Swapnil says, that the more people who have access to your data is good for you, because you may even strike up a collaboration when somebody sees this data and is also wanting or has an interest in the same things that you have, and then you know, collaborations can also take place. So I don't know if that's what Rajalakshmi was talking about. Are there any other questions? Let me ask. Yes, sorry. Yes,
If
Bharat.
I'm just out of curiosity, because I wanted to know this, uh, in your eye, ma'am, like, you know, what is a better study? The one which has a very comprehensively, or like, you know, a study which has been done very comprehensively with all the parameters which sir mentioned, which were evaluated in them, or just mere the uniqueness of the study, something new? Like, you know, like if you have to grade both of them, like, you know, how will you grade them? Like, you know, the is the unique one or the better study? I mean, obviously it cannot be just graded on that, but in your eye, like, you know, I want to know, like,
Well, it all depends on what the study is all about, no? There are unique and lots of unique kinds of things. But how have you actually dealt with that uniqueness? Why do you think it's unique? What is the uniqueness that you have brought to that particular study? Yes, I think that's good, but at the same time, somebody who has added to the existing literature also in a way which has made the existing literature very much more comprehensive, or has actually debunked some of the existing literature by just doing some studies which had probably not been done before, or the power or statistical analysis of the study which shows that whatever we have believed so far is probably not as on very firm grounds. It all depends. You know, I don't think that you know, one can go for one or the other. It just depends on the quality of whatever has been done. That's my honest answer. What do you say, Swapnil?
Yeah,
You're unmuted.
I agree with you. It is a difficult thing to say based on just one parameter or the other. But more than uniqueness, I would grade it on the rigorousness with which it has been done. Or the so uniqueness is important, but if even if it is a run-of-the-mill topic, if it has been done uh, truthfully and rigorously, I feel I would value it more than something not done otherwise.
thank you.
Shalini, you haven't said anything so far. What is it that you would like to say or ask or comment on or suggest, Shalini?
Ma'am, I wanted to ask if we could include pictures in our thesis, like we can take it from phone, or is it necessary to be from the computer or of the other Can we take them from the phone?
Shalini, as long as it's pictures from your study, I don't think it matters whether it comes from a phone, or it comes from a sophisticated camera, or it comes from something that has been digitized in your own lab. I don't think it matters, but why did you ask the question?
Because if we are applying, like after thesis, if we are publishing our thesis, so does it have any criteria for the pictures resolution or?
That's a different question altogether. It's not about whether you should or should not do something, whether it's legal, illegal, or good or bad. I think if you want to publish something, you have to get good quality images. And if your phone is giving you good quality images and the editors are happy with those images, I don't see then why you need to worry about it. But just make sure that your images are of good quality. I think that's what I would say. Swapnil, you have anything else to say?
No, I agree with that. What she probably means is very specifically to histology images and taking photographs on the microscope with a handheld camera or something of
I
that
guess
sort.
so, but there are some fantastic images that I have
Correct.
seen that people have taken, with very good, whatever you call it, pixel, high-end pixel cameras, and it gives you very good images. And
Yes. As long as
as
the images
long
are
as it
good,
shows
it
what you
depicts
want
what
to
you want.
show, and people are not looking at it, and you put an arrow, but still nobody can see what that arrow is actually pointing to. I don't think that that's a problem, and if you have no issues about getting it to published, then why should we worry? Yeah.
Yes, ma'am.
Are there any other questions? I don't know. Do you see anything, Divanshu, in the chat box or?
No, ma'am, no more questions in the chat box.
I see. Okay. So if there are no other questions in the chat box, but on your be on, I don't know if I can say this, Swapnil, but are you agreeable to anybody who thinks of a question sending it to you on email? Are you happy about that, or you are not happy about people asking you questions on email?
Yeah, I mean, I am happy with answering questions, but often it is difficult to answer them uh, because they cannot be answered over a single line of email. I mean, the question is, it might take slightly more than simple an email, single line of email.
All right. Okay. So if you have something a burning question, then I'm sure that Swapnil will answer it. Okay. So I thank everybody then. Thank you, Swapnil, and I thank the three students for
Thank you very
asking
much. Yes.
questions and sharing their questions with. There must be a lot of questions that are in the minds of all the students over here. But think about it, and I did see some teachers who were there listening to this talk. So I think it's food for thought for everybody. So I thank Nisha and Divanshu for having taken us through this thing as moderators, and of course, as usual, Ruchi and Calvin.